It's a great pleasure to be invited by TAG Implants. I have a big friendship with some very important people from the TAG company. Among them is Daniel Baruch. He's a very important person for me. He has guided me through implantology because he is the best person behind the scenes. Anyways, today's webinar is going to be something else. It's going to be something new. As you know, whatever you do inside the mouth doesn't have the same results, the same outcome if you don't do something about the perioral area. It's very important then to know and be able to combine facial aesthetics with implantology. And why I say that? I say that because as dentists, we have the privilege to be able to do the treatment inside the mouth and at the same time to finish the whole treatment of the perioral area. So now the concept is to have dynamics in the treatment of the dentistry and the facial aesthetics. My motto is stay young with your own blood. And what does it mean? Nowadays, with regenerative medicine, we have the ability to be able to use our own blood, to manipulate our own blood in a safe and predictable way, and to be able to rejuvenate the bone, the gums, and the skin, and the hair, and the joints, and many other things. And I will explain what I mean. For what we do in dentistry, in medicine, in everyday life is a teamwork. If you don't play smart, if you have people that they have knowledge and experience next to you and all together like a circle, you work, then the outcome of any treatment will be amazing. And what do I mean? I want to do implants, for example. I have to have a very good team next to me. I have to have a good machine, let's say an X-ray machine, CBCT. I have to have a scanner. If it's possible, I have to pick good implants and predictable and safe. And I have to have a team with me. It is important, for example, from the people who help you in the clinic and for your assistant as well. So whatever we do in medicine in general, it has to be teamwork. But let's see what factors are making a successful surgery. What you see in the right side of this slide is graft with PRF and membranes of PRF. And of course, I am convinced that PRF, your own blood in other words, can help you in every part of medicine and dentistry. So if you want to do a successful surgery, first of all, you have to know how to operate. You have to have very good examination. You have to have the information at the day zero. First of all, you have to see the patient. You have to conduct an examination, a physical examination. You have to palpate, you have to touch, you have to see. And of course, you have to have a good radiographic examination because you can evaluate what you see. If you have blurry x-rays, x-rays that they are not accurate, then your surgery will be a disaster. Whatever you do, it takes time. The consultation leads us to a good treatment planning. We have to know from the beginning what we should do. Of course, in surgery, there are some problems that they might arise, and we might have to change a little bit the treatment planning for the patient's benefit. But nevertheless, we have to have from the beginning a solid treatment planning. If we want to do a bone grafting, we have to select the proper materials for the case in order, again, to do a more predictable work. Now, about the blood derivatives, we have many protocols. Mainly, we have PRP, PRGF, and PRF. PRF was invented by Joseph Choucroun, and according to my experience, because I have used all the protocols since 2004, I believe that PRF is the easiest, the safest, and the most predictable in the bone augmentation outcome. Then, if we're talking about implants, then we have always to pick the proper implant in order to do the case. And what do I say? We have many implants, many shapes with different threads, more aggressive, less aggressive. If we want to be predictable from the beginning, we have to pick the right implant for the right case. Now, some words about the digital workflow. For me, it's something a little bit new because when I started with dentistry, of course, everything was free-handed when we're talking about implants. And I am going to show you what cases I do without the scanner and without the digital workflow. But nevertheless, now I have this scanner in my clinic. It is by Carestream, and I am very happy because I can do more accurate cases and I can do immediate implantology chairside for my patients. Now, another thing, in order to be able to do the digital dentistry, of course, we have to have a very good communication with our partners. Back to what I said, that it has to be a teamwork. So every time we have a case, we have to send the DICOMs to the lab technician. We have to send the scanning from the scanner of the mouth and the teeth. And then we are making the planning of the case. We have to agree, we have to give hints and say, okay, this is how we proceed. And then we are having the guide in our office in order to be able to go on with the case. Now, I have mentioned the PRF blood derivatives. This is the machine I am using. This is the Duo Quattro machine, and it is invented by Joseph Choucroun. What I do, I draw blood from the patient, I put it immediately in this centrifuging machine, and I have my platelet-rich fibrin. In this slide, you will see different cups, different tubes with different cups, and I want to separate them for the dental use, the green and the red ones, and the purple ones for the regenerative medicine use. So with these 10 ml tubes, we can make the sticky bone and we can make the membranes. From the other hand side, we use PRF in a liquid form in order to rejuvenate the skin, the hair, the joints, and many other things by having PRF in a liquid form. So this is my PhD thesis. I used PRF in combination with a synthetic graft with very promising results. And this is a second review that we used PRF in regenerative dentistry. And of course, the results of the cases were very satisfactory. And you see every day now, more and more dentists, and not only doctors from all over the world, are using PRF in order to facilitate the procedure and to accelerate the healing process for the bone, the gums, and the skin. Now, what else can it be a very important factor in order to do a good surgery? we have to have the implants, and we have to have more implants that we need in every case, because we might have an accident. For example, let's say one implant falls down, or we might need another size. So if we have a case that we need 4 implants, for me, I always have 15 to 20. So I want to be safe and secure that whatever happens, I will have a backup implant. And of course, all the people from Israel, all the companies from Israel, they have made all these kits for dummies. And it's like Apple. Apple is for dummies because it's very simple. So for example, if you want to do the flapless, you have this color coding that it leads you exactly to what you should do with your eyes closed. So it's very, very easy. And for me, it very gives me the security, the feeling that, okay, whatever happens, it's 1, 2, 3. So it's easy and very, very predictable as a treatment. But okay, this is the new technology. This is the digital workflow. But what has happened all these years? For example, I did this case. She was taking drugs for osteoporosis. We had to manipulate the surgery. We had to use PRF, bone grafts, the right implant, and we did the treatment. And you see, 12 years after, how the mouth is, how stable the result is, and how healthy are the tissue. So this is not because I am an exceptional surgeon. This is happening because I have followed the steps in order to do it predictable. And not only, I am doing the recall, I see how is the situation, and every time I see a problem, I just work on a side. I don't work in the whole mouth. And of course, I will present to you some clinical cases in order to understand how I proceed in combination for the bone augmentation, for the implantology, and for facial aesthetics. So this is my patient. He has diabetes. He is a smoker. He is not a person who takes care of his oral hygiene. And of course, you see the results. He has no teeth in the upper jaw. He was wearing an overdenture, and he has aggressive periodontitis in the lower jaw. So we decided to extract this tooth and this wisdom tooth to do an augmentation, and of course, to put an implant here and proceed with 6 implants in the upper jaw. So this is how the case was initially. You see how much calculus you see around the neck of the teeth, and here and here. And we did the surgery. We put the implant. We put 6 implants in the upper jaw, and we had to proceed with the prosthesis. At this point, when I did the surgery in order to put the healing abutments, because as I said, this patient has diabetes, the healing wasn't the proper one. So in order to accelerate the healing, I used the liquid PRF, and I was injecting at the adjacent tissue, and not only. At the day of the surgery, because I did it with an open flap, I used the membranes of PRF in order, again, to accelerate the healing, and especially in this patient who has diabetes. So this is how I do it. And I go around, and I am trying to inject the liquid PRF in order to facilitate, again, the healing process. This side is worse than this side. So what I do, I inject, and I recall the patient in a week to see how is the situation, and I might proceed with my prosthesis, or I might repeat the same procedure. So you see here how is the acceleration of the tissue, and I am injecting again. This side is almost perfect, so I don't have to worry. This side needs more help. So I do it. This is a 13 millimeter long needle, and I am trying to add the growth factors and the stem cells in this area in order to help my patient heal quicker. This is the end point. This is how I finish the case. You see from the palatal side and the end point, a happy patient. We reconstructed the perioral area. He's not, he is trying to laugh, but he's a little bit stressed, so you don't really see him laughing very well, and you can see what we have achieved from the profile of the patient. This is another case. This case, it's really hard. This woman is 43 years old. She doesn't smoke. She has mild osteoporosis. She is a dentulous for many years in the upper jaw, and she has advanced periodontitis in the lower jaw. She is a very beautiful lady with blue eyes, very elegant. But as you see here, she has a big aging in this area because as we are getting older, we have bone resorption in the upper and in the lower jaw. So if we lose the teeth, this is multiple. And of course, we are looking very, very aged, very, very sad in this lower part of the face. So this is how she's looking without the denture. And this is how she came to my clinic with this denture in the upper jaw and this bridge in the lower jaw. You see the problems that she has here. So both you see here again. This is the lower jaw. She couldn't wear any partial denture because she didn't like it to begin with. And this was the major problem in the upper jaw. In the upper jaw, from this side, the right side, she has vestibule. From this side, the left side, she has big resorption and no vestibule. So the denture wasn't stable, and all the time she couldn't eat, she couldn't talk, and she had major problems. You see how it's from both sides. This is the panoramic, and this is the panoramic, and this is the CBCT. And of course, in the upper jaw, we couldn't do many things except if she was willing to do big sinus lifts, but she didn't want to do it, and she wanted to go on with the lower jaw. And then we had to find a solution for her in order to have the denture in the upper jaw and to be stable because she couldn't do anything with this. In the lower jaw, in between the mental nerves, we had the ability to put implants. And of course, I put 7 implants in the lower jaw. So this is the lower jaw. When we had, we extracted all teeth, we had to do the osteoplasty in order to make it even and be able to put the implants and then to put the prosthesis on top of the implants and to be nice and even. And this is how we put the implants, 2, 4, 6, we put 7 implants, I think in this case. And we just remove the excess of the bone, that the tips that they weren't making the lower jaw even. And this is 1, 2, 3, 4, 5, and then we put more implants, and we just remove these edges of the bone and did the augmentation. These are the membranes of PRF, and when we finish, we put it on top of the bone, and then you see here, and then we do apical matrices in order to stabilize the tissue and with the movements of the mouth doesn't open, the flap doesn't open, and we will have the reinfection of the implants. And now we come to the big issue, to the upper jaw. So what can we do here in order to increase the vestibule and, of course, to increase the stability of the overdenture? In this case, we do the vestibuloplasty, you see here, and we are putting sutures in this area. And here you see the bone, and it's getting a little bit blue. This is the sinus. And we had to stabilize the tissue here, because if we leave it this way, it's going to collapse, and then we could have the same problem again. So what should we do in this case? First of all, we are putting the membranes of PRF in order where we had the cut to accelerate the healing, and we are taking the overdenture. Now, because we have a deeper vestibule, we are readjusting the denture, and then we are opening a hole in the middle, and you see here from the sides, and after we're taking viscogel in order to adjust again the denture inside the mouth. We did this surgery in a hospital, of course, with general anesthesia. We went, put it in the upper jaw, and we screw the upper jaw in the palatal, but it wasn't enough with one screw, so we used 2 screws in order to leave it there for 15 days. You see how we finished with the operation. It wasn't so easy to remove all the excess from this side. We did our best, but it wasn't so easy. So we left it, as I said, for 15 days. And after this is what we saw when we remove it from the palatal. So this is the excess of the viscogel, and of course, some food there. Both sides, she couldn't clean very well. And let's see, here are the holes, and let's see how it was when we remove it. So we cleaned the area with peroxide and with saline water. But the most important thing is, you see here, when we did the vestibuloplasty, we are having new blood vessel formation. So it was amazing when we cleaned the area, how was the healing for 15 days in such a big operation. So here you see, and again in this area too. So we were happy to increase this vestibule and be able to give a more stable denture for our patient. In the lower jaw, as you remember, I put it the implants, but when the patient was closing the mouth, because she had screwed the upper in the upper jaw, the denture, she was traumatizing this area. I was worried, to be honest, because I had done the surgery and put the implants. But what I did again, this is the upper jaw, I'm sorry. These are, I'm sorry, I put 5 implants, not 6 implants, not 7. And what I did before, when it was traumatized, I injected again PRF. So in this case, these are the implants I could have put. You see how healthy the tissue is now after all this procedure and with the use of PRF. This is the try-in of the lower jaw, and this is how we ended up with the case. For me, the most important is with some little treatment of the perioral area. We have a happy, satisfied, and functional patient. We can combine 2 things in one treatment. So for me, this is the biggest advantage of this case. This is another case of our patient. He was very phobic He didn't want to go to a dentist. So as you see here, he is 60 years old. He is a smoker. He has a high position in work, but he didn't really take care of his teeth. So this is how the situation was. And of course, the treatment planning was to remove all teeth and to proceed with the implants. You see, the situation is terrible and nothing is worth it to be kept in his mouth. So you see many feelings, many problems, periodontitis, unhealthy tissue. And this is how we started to do this case. We decided, because as I told you, he has a high position, to keep these two canines in order to have something provisional until we put the implants and just wait a little bit and then to extract these two canines. This is when we finished the surgery. Again, we did this surgery in the hospital under general anesthesia. This is from the lower jaw. And in this case, we put 3, 5, 7 implants in the upper jaw, and we put 6 implants in the lower jaw. As you see, we had kept the canines in order to have something for this patient to be able to have something provisional. And this is when we went to this prosthetical part, to the second stage operation, in order to put the healing abutments and proceed. These are some plastic caps that I put there when I did the surgery, and I was waiting a little bit for the healing in order to proceed with the provisionals. I'm sorry. These are the provisionals in the upper and the lower jaw. This is not my case. This case was referred to me by a general dentist. This is how they did the provisional. It wasn't so easy for the patient to clean, but we just readjust this area in order to be able to put the proxy brush in this area. This is when we took the impressions in the lower jaw as well. We made this customized impression trays in order to be able to go as predictable as possible and to be able to keep the impression material inside the trays, because the patient had problems with vomiting. And this is how we finished the case. And of course, the patient is happy and functional. So he has this prosthetic work in the upper and lower jaw. The tissue are very healthy. The only problem we had, he couldn't clean this area here. So we had to recall him until we make him be able to clean it very well, this area. This is from the side. And this is the upper lower jaw from both sides. And the palatal side and the lingual side. The patient started like that. The patient is looking like that. So for me, it's very important to be able to give to the patient both, to give function and to give aesthetics as well. So you see how the skin is here. You see how the mouth is here. You see how the smile line is here. So this is, again, a teamwork. This patient was referred to me to do some work. The lab technician did some work, and the general dentist who referred this case to me did the rest of the work. If we all have a teamwork, we talk about the case, we consider all the factors that they might contribute to the success of the case, this is how we can end up. And of course, things, as I said in the beginning of my lecture, are improving, and all the time we have something new. So this is my passion right now. This is the digital workflow. Of course, the company that you cooperate has to have people that they know what they do and they love their work and they are willing to work with you and again have a teamwork. So this is an example of the case. We want to be able to manipulate the implants, to turn the implants, to see from one side, to see from the other. Of course, digital implantology is very important when the mental nerve is very close. You want to see if you put the implant with this inclination, how the problem will be according to the mental nerve, how long you can go, how much the width is. So all the time, it's much better to be able to visualize the situation. It's much better to be able to see from every side what you can do. And of course, good communication with the person who is dealing with your case. And of course, what are the benefits? The benefits are that somebody comes without teeth in these certain areas, or it might be a totally edentulous case. And then this patient with sometimes no flap at all, sometimes with flaps, you can put the implants and you can do the immediate loading. So this is very important because some people don't have the time, don't have they don't want to come back and forth. So they come, they pay, and they get something that is functional and is the proper thing for their case. So for me, I highly recommend this. Of course, if you want to go digitally, you have to spend money, you have to buy a scanner, you have to have maybe more expenses because you get a guide, and it's a little bit different to the system that we have learned up to now. But I think that it's a very innovative, it's very good way, and maybe in 90 of the cases, it is what we should do. So this is what we did for my case. She had lost the 2 teeth in the right side and 1 tooth in the left side. We did BCT, we sent the DICOMs, we said the scanning of the mouth, and we sent it to the Center of TAG Implants. And of course, this is what we got, Dr. Cleopatra Nacopoulos. These are the provisionals. And of course, before, how the case was. When we put the guide was perfect. I have used other systems, but this is very accurate. And I mean, usually when you work, you have to stabilize with your hands the guide because it's not so stable. In this case, it was totally stable. I used my hands. I was holding the guide, but it was very, very accurate. I was so happy. And of course, flapless, we did the operation. We put here the provisionals, and this is how she left from our clinic. Of course, this is not chewing, so you put this under the chewing ability, but the patient has teeth, and of course, it's very happy. A few words about how I am using PRF for facial aesthetics. This is a lady, how she came to us with no teeth. Her dentist put 3 implants. The lab technician did the work. So she had 2 overdentures, and I did the facial aesthetics, 4 treatments. This is in 2018. 2020, she did no treatment, and you see how the face is and how stable the results are. And Now we are in 2022, and the patient, the skin of the patient is in the same condition. Of course, we can combine both teeth and facial aesthetics, and you see the results. For me, this is the amazing thing, the amazing feeling you are getting from your patients when you finish the case, and not only the case, you give them a nice face, a rejuvenated face. For you that you want more information, let's keep in touch. You can follow me on Facebook. I have two profiles, Cleopatra Nacopoulos and Cleopatra Nacopoulos. I have two pages, Cleopatra Technique for Aesthetics and Cleopatra Technique for Aesthetics 2. And of course, I have for the dentists and the doctors, two groups in Facebook, WAPS Aesthetica and Aesthetica by Cleopatra Nacopoulos. We present cases. You can become a member there. You can invite your colleagues to become members. It's free. And we're trying to post cases in order for us to learn from each other and to be able to share our experience and get the experience from the other colleagues. So thank you very much for your kind attention. I'd like to thank GMDA Hub for the organization and TAG Implants. And I can really tell you that if you want to change your treatment, to improve your skills and to go further, then you have to pick the best implants, and you have to pick a very accurate lab that will prepare your surgical guides in order to do it predictably and in order to be able to give to your patient happiness and function. So thank you very, very much. And if there are any questions, I will be more than happy to answer to them. So thank you very, very much. Have a wonderful night, evening, morning, I don't know, because we are from different parts of the world. I thank the Greek colleagues that they're been with us, and I hope that we will meet soon in person. Bye-bye, and thank you very much. Bye-bye.